I'm now going to ask the rest of the panel if they could please come forward. Nick, Louise, and Linda. We're going to do a Q&A. So this is your chance to get some questions in. And by the way, Paul, I just want to give you a huge pat on the back for that. It's very generous of you to share your story. Have a seat, guys. Is Nick still around, or is he gone? He went, probably. Okay, so if you have questions, we'll grab the mics there. Go ahead with your question, sir.
Hi, I have stage 4 cancer, now the whole kidney out. Now, you're saying about exercise. Is it the same for a person with one kidney? And also, how does diet affect that as well? Because I hear a lot of people talk about exercise, but there's nothing about nutrition and diet and what not to eat and how to control creatinine through diet and exercise. And are they linked?
So the guidebook is relevant for those who are still on treatment, whether or not you have bone metastases or metastatic kidney cancer. So the idea is to follow as much as the physical activity guidelines as possible. So if you want to experience maximum benefits or some benefits, doing some activity is better than doing nothing. So the key is to avoid inactivity. Do as much as you can tolerate. So if you find that there are certain days it's really painful or you're facing really bad side effects, you can reduce the intensity and the duration of your activity, but just don't avoid inactivity during that time. And I can't comment too much on the nutrition or diet side of things because I am more of an exercise researcher, but I think the general rule is if you follow the Canadian food guide and then supplement that with exercise, it usually is a good complement for one another. But if there's something that you're unsure about in terms of diet, you can certainly speak with your doctor about more information about what sort of foods you should be eating. But even if you're concerned about exercise levels, you can always speak to your medical oncologist and doctor and suggest to them that you'd like to start an exercise program and ask if there are any sort of special considerations or precautions that you need to take into account. But the general recommendation is to avoid inactivity even during treatment and post-treatment and try to do as much as you can tolerate. Yeah.
Thank you. Any other questions? Yes, we'll bring a mic to you. Go ahead.
Another standing ovation. I'd like to ask Paul a question. As a cancer patient myself, I'm wondering, did you ever lose hope? You talked about your first diagnosis and you went on a trip, you had a great time. Was your second diagnosis worse? Did you think all hope is gone and was the second one worse than the first one? How did you feel? Like, did you maintain hope through the whole thing? Thank you.
I think it's on, Paul. Just go ahead.
Yeah, I really didn't try to think about it too much. So, no, I knew I had problems, and I know I still have problems. I just try to think positive all the time.
Any other questions? Just talking a little bit about side effects. Now, one of the things you had mentioned, and I'm going to go from my experience, and that is that general practitioners didn't seem to know enough about, I was on Sutin, for instance, so I know because I became informed about it, but I would go in and the doctor would prescribe a cold, for instance, a decongestant. So can you just talk a little bit about that?
Because these agents are relatively new, I think most family physicians and most people in the public think that chemo is chemo and you're going to get tired, you're going to get nauseous, you're going to get vomiting, you're going to lose your hair, you're not going to eat. These agents really do not do that. And it's very important for you to probably, I think the best situation is to go to one pharmacy only so that they have your whole medical record and they have each agent that you are taking, each drug that you're taking. Because if your physician had prescribed a cold medication with a decongestant, if you went to the same pharmacy and the pharmacist would say, no, you can't take that because your blood pressure is going to go up, I would recommend something else. So I think that is probably very important. And I think that if you ever have any questions about drug interactions, you should have some kind of relationship with a pharmacist or a physician or someone, because there are a lot of drug interactions with these agents.
And just very quickly, grapefruit?
Not. Sorafenib is probably the only one that you may be able to have grapefruit, but all these agents are metabolized in the liver through the same enzyme system that grapefruit interferes with. So grapefruit is not a good agent to be taken with these agents.
Thank you. We have another question over here.
Hi, my question is for Louiselle as well. With the nivolumab, other than the itis things, which sound pretty serious, are there any other common side effects? Like, do you end up with the same ones as you end up on the first-line therapies?
Probably not going to have the hair changes. You're not going to have the hair color change, the hair falling out. You probably will have the same fatigue. And again, because it can affect your thyroid, it's important to let people know that you are on this agent, and we can do some blood tests for that. It probably will not affect your bone marrow, so your white blood cells, your red cells, as it would the other agents will. But yes, you can have some of the same, and you can have diarrhea also, but it's not as common as with the other agents.
Any other questions? Yes, we'll bring a mic to you right away. Though generally, I check one of the doctors in the room. Generally, if you're on one of these, let's try with Anil. Anil, just a quick question. If you're on many of these oral therapies, generally you're having regular blood tests anyway, are you not? And you'd be looking for thyroid issues, would you not? If you, yes, okay, just so that your doctors do look for that. Go ahead.
My question has to do with the role of vitamins. I mean, you think you're supposed to have a healthy diet and you add vitamins, but then I'd heard, like halfway through Steve's treatments, that maybe the cancer cells like vitamins even better than the rest of your body cells, and maybe you shouldn't be having any vitamins. So what do you have to say?
A lot of these agents work as killing the oxygen to the tumor. So, and a lot of these vitamins can either supply more oxygen or less. So there's not a lot of really good evidence to suggest that you should. I know that there are cancer centers or integrated centers that advocate multiple mega doses of vitamin C or mega doses of vitamin D. I would be very cautious of that because we just do not know what those doses do to the cancer. There are some anecdotal, like a case here, a case there, where a patient will do better with them. But mega doses of vitamin D is very hard on your liver. All these drugs are very hard on the liver. So I would really tend to stay away from that. Vitamin C is another one that we just don't know. Injectable vitamin C, personally, I would stay away from. We've had a couple of really bad scenarios in Ottawa with injectable vitamin C. So be cautious. St. John's wort is another one. It's like grapefruit, except it's in the opposite direction. So you should stay away from that.
Thank you to all of the panelists.